Good afternoon, bonjour. Today, I'd like to offer on assessing our collective risk as we learn to live with COVID-19. But first, I'll begin with the latest numbers. Il y a eu 108 155 cas de COVID-19 au Québec.
There have been 108,155 cases of COVID-19 in Canada, including 8,790 deaths. 66% of people have now recovered. Labs across Canada have tested over 3,257,000 people for COVID-19 to date. Over the past week, an average of 40,000 people were tested daily, with 1% testing positive. These numbers change quickly and are updated daily in the evenings on canada.ca/coronavirus.
There have been 108,155 cases of COVID-19 in Canada, including 8,790 deaths. 66% of people have now recovered. Labs across Canada have tested over 3,257,000 people, and over the past week, an average of 40,000 people were tested daily, with 1% testing positive. These numbers change quickly and are updated daily in the evenings on canada.ca/coronavirus. À mesure que de nouvelles régions au Canada.
As more regions of Canada move forward with resuming activities and opening public settings, it is important to think about how the choices we make and the actions we take can impact not only ourselves and our families, but also our communities.
We make decisions as we go about our day-to-day routines, knowing that COVID-19 is still active in our communities. We make choices such as whether or not to go into a shop, accept a social invitation, or head out camping or to a cottage where the weather is nice. We consider who makes up our social bubble, and in turn, we make indirect connections between each of our close contacts and their social bubbles. Understandably, this phase of the pandemic remains an uncertain and stressful time as we carefully in order to make what used to be easy, everyday decisions. Je tiens à ce que vous sachiez que vous n'êtes pas seul.
I want you to know that you are not alone. We are all in this together. And we have learned a lot as we flattened the initial epidemic wave that we can all use to lower the risk to ourselves and our communities moving forward.
So let's review some actions you can take every day to help lower your risk and to make day-to-day decisions a little bit easier. Tenez-vous au courant des nouvelles et des conseils.
Stay informed by following news and advice of your local public health authority. They know best the situation in your community and what public health measures are most important to control spread in your community. Carry the essentials. Keep a non-medical mask or face covering and a pocket-sized hand sanitizer with you wherever you go.
The 3 C's, much as possible. Number 1, closed spaces with poor ventilation. Spend time outdoors and in locations with good ventilation, such as at a park, on a patio, or in a room with open windows. Number 2, crowded places, with large numbers of people gathered close together. Whenever you go out, maintain physical distancing as much as possible, and when you can't, wear a non-medical mask or face covering. Number 3, close contact, where you can't stay 2 meters apart from others. Only let a small number of individuals inside your 2-meter bubble. En français, évitez autant que. Numéro 1.
Avoid the 3 C's as much as possible. Number 1, close spaces with poor ventilation. Spend time outdoors and in locations with good ventilation, such as at a park, on a patio. Number 2, crowded places. So, where it is impossible to maintain 2 meters between you and other people. Only let a few people into your small bubble. And avoid close contact, where the space is not well ventilated. Go instead to a park or a patio or rooms with open windows.
All age groups, including young adults, who can experience severe illness and can spread infection to others. Enjoy safer social outings by keeping these 3 C's in mind, ou le bec. Every single one of us becoming sick with COVID-19, even the youngest and most physically fit among us. Whenever you go out, follow the advice of your local public health unit. Et surtout, tenez-vous loin des autres.
And most importantly, stay away from others and consult public health for advice on next steps if you have any symptoms of COVID-19, no matter how mild. When we keep ourselves and our loved ones safe, we help keep our community safe as well. Thank you.
Thank you very much.
Thank you, Dr. New. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mic. Over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. La première question est de Marie Vastel du Devoir. À vous la parole.
Question. Yes, hello, Dr. New. Regarding hotspots that we've seen outside of the regular epicenters like Montreal, I would like to know, do you believe that it would be good to lock down certain regions to stop the movement between these regions and to stop the spread of COVID-19 with people traveling and unknowingly spreading COVID-19? Should we ban the movement between regions? Answer. Thank you for this question. I believe that local health authorities and provincial health authorities will be the best place to analyze epidemiology in a specific region. And they would be able to manage the situation. It's not up to me to give comments. It's a little tough because I'm not close to the situation, for example, in Quebec. What I can tell you is that in Quebec yesterday, it was said that from July 18th onward, wearing a mask in indoor public spaces will be mandatory. And I think this is important because we know that construction holiday is coming up in Quebec and a lot of people are going to want to travel. And also to answer your question, the capacity of the country and in Quebec is very good regarding detecting, screening, and isolating cases of COVID-19, and we have gotten good at doing quick contact tracing, and this is key in order to continue to control the spread of the virus here in Canada. I believe that wearing a mask is important. The proof is here. It's especially important in closed spaces. So with the data that is evolving, we learned that people who are asymptomatic and in closed spaces, the risks are higher for the spread of the virus. So it's a good idea to wear the mask. It's something that we encouraged multiple times, but now in Quebec it's going to be mandatory. Not necessarily because it's impossible, or not only where it's impossible to maintain 2 meters, but everywhere inside. Follow-up question? Thank you. My question didn't have to do on wearing masks. It really had to do with traveling between regions. I know that you've said that it's the decision to be made by local health authorities, but you're the federal health authority and you have a good understanding of this epidemic. So as an expert, what is your opinion? You said that construction holiday is starting in Quebec. People are going to want to travel. Should we limit travel so that there isn't a new wave of COVID-19 in different regions? Answer. I think that in Quebec and in Canada, we have the capacity to detect cases and to do contact tracing. Quebec, as the rest of Canada, is currently easing public health measures. Canadians and Quebecers worked hard and made sacrifices in order to flatten the curve. So it's normal now that it's nice, and with the easing of lockdown, people are excited to travel, but we need to be cautious. We want to avoid small spreads, and public health authorities are ready, and it may not be necessary to limit the travel between regions in Quebec, but it's something that we'll need to follow. Because, well, I also saw or heard anecdotes and heard about situations where there were parties with young people, and that might have caused a spread of the virus in the south of Montreal. So we need to maintain the public health measures. It's an individual responsibility to do so. If the Canadian population continues to follow the regulations, then we will be able to control the spread of the virus here in Canada. But because of some young people who may not be following the rules, well, then we may have a new spread. Next question, please.
Thank you. The next question is from Mia Robson from the Canadian Press. Please go ahead.
Hello, Dr. New. I'm wondering if you have any thoughts on this debate going on about reopening bars. We've seen places in Quebec and Newfoundland and also in the United States deciding to scale back that opening after problems, and Ontario is moving now to open them. And there's a lot of people that worry that this means that schools won't open in the fall because we're opening bars now. And I'm just wondering if you have any thoughts on whether that is actually a risk.
Very good question. I'm going to separate it, bars and schools. So let me just talk about bars first of all. I think I was speaking at a previous press conference in terms of the fact that science continues to evolve and the evidence also continues to grow in terms of what are the risks and how is the virus being transmitted. And it's interesting. Early on, I think all of us understood that it was primarily droplets, and therefore we should really be focusing on people who are symptomatic with a cough, a fever, and so on. Then the evidence came forward that people who had very few symptoms, or maybe even people who are asymptomatic, were also capable of transmitting the virus. And now what we're seeing is that if you look at the range of the kind of droplets that people could be sort of transmitting into the air, besides large droplets, we also understand it's a gradient. So you have small droplets that also can be expelled as someone talks or sings, and even what we might call micro droplets or aerosols. There's no evidence to date, based on the examination of outbreaks around the world, that COVID-19, I would say, is not an airborne disease in a classic sense, like very highly contagious airborne diseases like measles. But certainly it appears to be more contagious than, let's say, for example, other respiratory infections like influenza. So in that regard, we've also seen evidence that the risk is higher, as I just mentioned, in indoor spaces where the ventilation is poor. And therefore, I think we're lucky here during the summer months that people can go outdoors and I guess in many ways decrease their personal risk. The other way to maybe explain it best is that using a bit of the analogy of cigarette smoke. If you're outside and you're beside someone who smokes, I'm a big non-smoker or an anti-smoker. And so if someone is outside and smoking, you can smell the smoke, but the smoke and the fumes or whatever can dissipate quite rapidly outdoor with obviously the air currents. if you're indoors and close to someone who smokes, obviously the plume or the cloud of smoke lingers longer, and you're exposed for a longer period of time. And so if you think about it in that sense, that might be the risk with COVID-19, that these micro droplets could hang around for a few minutes longer in the air rather than just large droplets falling quickly to the ground. And so I think if you look at the situation in bars, they're closed spaces. I can't speak from one bar to the next in terms of what the state of their ventilation is. But certainly the fact that people might be there also for a prolonged period of time, duration of exposure is also a key factor. All those things I would say put people at higher risk. So I think people need to evaluate, I think at a personal level, the risks and benefits of going to a bar and what they could do to mitigate that risk.
Thank you, Dr.
I noticed you didn't. I noticed you didn't really link it to the risk that things this fall, like schools, can't happen. But I'd also like to ask you about baseball. You said a couple weeks ago that you were comfortable with the Blue Jays practicing on their own in Canada, but you were less certain that bringing other teams in to play into the country would be safe. Can you tell me what the status is of the discussions about that, and if there's been any movement, or if you've changed your mind and you think it would be more safe to allow teams to come in to play the Blue Jays?
No, the conversations, the discussions are still ongoing, very active discussions, and certainly what I said a week or so ago still stands. I think in terms of the spring training, the Blue Jays certainly put measures in place, and we, I think, at all levels of government, the local level with the City of Toronto, the provincial level with the Province of Ontario, and ourselves at the federal level, we're comfortable that the measures put in place really is sort of a very tightly controlled, if I can call it, the work quarantine bubble, did allow for the Blue Jays to, in a sense, be able to train safely as a team, but also not put the general public at risk. The issue of the regular season, I think I was speaking to the potential of travel across the U.S.-Canadian border, not just the Blue Jays leaving town and then coming back after a road trip, but also for teams coming in. That obviously is, as I said before, a totally different ballgame. And those discussions are ongoing. But I think what I would say, and you can certainly look at the data, is that the situation in Canada and the U.S., I would say from a pure epidemiological point of view, is vastly different. If the epidemiology of the U.S. and Canada with respect to COVID-19, I think we're similar, as sort of has been the thinking, let's say, in other countries in the European Union as to why there might be a quote, a loosening of let's say, travel across borders. We might be having a different conversation or different thinking. But the fact of the matter is today, here in Canada, we've done, I think, a good job of flattening our curve. If you look at the number of cases we have on a daily basis, it's somewhere in the neighborhood of about 300 or so cases per day. In the U.S., obviously, I think it's been more than 60,000 or so per day, and certainly the situation doesn't appear to be changing quickly in the U.S.
Thank you, Dr. New. Operator, next question on the line.
Thank you. La prochaine question est de Catherine Lévesque de la Presse canadienne. À vous la parole.
Oui, bonjour.
Yes, hello, Dr. New. Can you talk about clinical trials of Medicago? Clinical trials on humans will be starting soon. Are you encouraged by these clinical tests, or do you think we should be very cautious? I just wanted to know what you thought about that. I think, as everyone, I'm eagerly awaiting to see what's going to happen with vaccines. There are hundreds of candidates for an effective vaccine. Another important thing is that there are studies that show that if we were infected with the virus, the immunization doesn't last. So it's even more important now to develop a vaccine against COVID-19. in Canada and in the world, it's encouraging to see what's happening because we've moved on to a next step with clinical trials and vaccines. But we're going to have to wait a while to see if these vaccines are effective. There are a bunch of steps in the methodology to assess the results of a clinical trial. We need to ensure the safety, of course, of this. So I believe that we are close, perhaps, to having a vaccine, and experts throughout the world think actually that it won't be before 2021 that we get a vaccine. It certainly won't be in 2020. So, yeah, 2021 before we have a vaccine ready.
Dr.
Yeah,
Verpetyan.
just in terms of vaccines, we're just talking about various clinical trials here in Canada and around the world. I think it's very encouraging. There are easily over 100. I think about 150 or so vaccine candidates. They're being looked at around the world. Here in Canada and around the world, various trials are now underway. I think it's even more important now that we move in terms of vaccine development and also treatments, because other studies have also shown in terms of immunity that the antibodies, that even if someone's been infected with COVID-19 infection, that any immunity, the natural immunity, is not very long-lasting, maybe a few weeks, several months or so, and certainly not something that we can count on in terms of over time getting that so-called population herd immunity just based on natural infections. So that's why vaccine development, I think, is going to be very, very important. What's I think also important is that we do these trials properly. And as I said, that it'll take time. We're having people being vaccinated now. We need to analyze the results, make sure that there's proper methodology to critically look at the results. Obviously, ensure the safety of the vaccines. Lots of different steps still ahead of us before we might even anticipate that there might be a safe, effective vaccine that would be available for use in the general population. Most scientists, being very optimistic, might think that it'll be before 2021.
Merci, Dr. Catherine. Votre suivi?
Follow-up question? Yes. So you seem cautiously optimistic, and I get that. Regarding now the border will remain closed for another month. Is this a good idea, considering the spread of the virus in the United States? Do you think that the government should extend the border closures to the end of the year, for example? Answer: I can only give advice regarding public health. I think that it's important to closely examine what's happening in the States, but also in Canada with our own epidemiology. There are, of course, differences between the United States and Canada regarding epidemiology and the spread of the virus. We know that the ties between Canada and the US are important for social and economic reasons, of course. But it's important for Canada to protect Canadians, to protect their health and safety. We've made a lot of effort in Canada, and Canadians have sacrificed a lot to flatten the curve, and we don't want to waste these efforts, all these efforts that we've made so far. And so I think it's important to examine what's happening in the United States. And then we can see what to do at the border. Dr. Tam and I and other experts continue to offer advice based on data and public health data. We give this advice to the government so that they can make decisions regarding the border in the future. Thank you.
In English, with respect to the U.S.-Canada border, what I would say is that we continue, obviously, to look at the epidemiology of COVID-19, both in the United States and also here in Canada. And I would say at the present time, I think people can appreciate that they are vastly different. Here in Canada, I think we've done a good job of, as they say, flattening the curve. We have an average about 300 cases per day in Canada. I think in the U.S., quite a bit more, 60,000 plus cases are reported every day. Certainly, myself, from a strictly public health perspective, we recognize that the priority in many ways is to protect the health and safety of Canadians. Canadians have made tremendous sacrifices to date in terms of flattening the curve, and we're seeing the fruits of our labors, to be quite honest. And I think we're very mindful that we don't want to, quote, waste those efforts by potentially, quote, reintroducing the virus into Canada and increasing the risk of further transmission. So therefore, it's important that we look at what's happening in the United States and continue to monitor. We recognize, of course, and I can only speak as a public health expert, that there's so many important aspects to consider in terms of the U.S.-Canadian relationship, economic, social, and otherwise. But from a strictly public health perspective, certainly the measures we've taken to date, I think, are reasonable. And certainly myself, Dr. Tam, and others, we will continue to give this government our best advice based on the public health perspective in terms of the evidence and the data we have to date.
Thank you, Dr. New. We'll now turn to the room. Kelsey?
Thank you, Dr. New, for taking my questions. I actually have questions from my colleague, so I'm just going to relay them. So you have said quite a bit in your press conference that we've done a good job on flattening the curve, and I would also note that the number of deaths being reported has declined sharply. So I'm wondering, what did Canada get right, and what lessons could other jurisdictions learn from Canada's experience?
I have to think about that. That's a tough question. What did Canada get right? I think we've gotten a lot of things right, but to be quite honest, obviously there's lots of things I think we could do better in the future, and there's a lot of lessons learned. And I think the first one I would put forward, and I think everyone knows that, is what's happened in our long-term care facilities. So in terms of vulnerable populations in congregate settings, specifically the elderly in our long-term care facilities, but also beyond that, we've also seen that the other vulnerable populations in congregate living settings, for example, temporary farm workers, individuals in homeless shelters, they've also, I think, have had sort of an increased risk of adverse outcomes compared to the general population. So I think moving forward, as we continue to put in the right public health measures, I think we also need to make sure that, I'm not sure if that's the right term, ring fence, make sure that we also continue to protect those vulnerable populations. So that's sort of on the side in terms of what we could do better. In terms of what we've done right, I think at the macro level, what I personally, and this is a personal opinion, I think I've been very impressed with, is that governments across this country, not just the federal government, but also provincial governments, and even though I'm not a politician, I know that they come from different, let's say, political parties, have worked very well together, have been apolitical. I think everyone across the country in governments have recognized that we're all in this together, and the collaboration, for what I've seen, has been nothing short of amazing. Certainly, I think many people don't realize for the past several months, late into the evening, at the highest levels between ministers of health, between deputy ministers of health, myself and Dr. Tam, we also have regular teleconferences with the chief medical officers of health from across the country. We look at the evidence, we share information, we look at best practices, what the science shows us, and then we make we put our best foot forward in terms of what we could and should be recommending to the Canadian population, the best measures. And I think overall there's been a very coherent response. The other part I think we've done right in Canada is that as we've put forward the best advice from a scientific perspective, I think the Canadian population, to their credit, gets it. They look at what public health officials put forward, recognize that it is based on the science and what is really in their best interest. And I think as a society, we're very good in terms of listening and understanding what could or should be done to not just protect the individual. I'll just put as an example how the issue of face masks, face coverings has evolved. Initially, no one would have thought we'd get into the space of using face coverings, and now we're in a position today that some jurisdictions like Quebec have actually made it mandatory across the province in terms of indoor spaces. That also, I think, has not been political. It's not been politicized, and people get it regardless of your political background. That it's just a good, simple, effective way to do your part to help stop the transmission of COVID-19. So I think those are some of the things I think we've gotten right, both at a government, public health level, but also in terms of the Canadian population as a whole.
And then just as a follow-up, Ontario announced yesterday that many parts of the province, not all, but many parts of the province will be moving to stage 3. So I'm wondering, are you concerned about a possible spike in cases, or is a spike even certain? And what more could authorities be doing to minimize the risks?
That's a tough question. As we've said several times before, we can't sort of remain in lockdown forever. And so as we've gone into the summer, provincial governments, obviously based on the sort of their local reality, the context and epidemiology, have slowly gone at different speeds and different schedules in terms of opening up various sectors. The one thing that everyone's agreed has to be put in place, and I think it is in place across the country, is, as I mentioned several times, the capacity to offer testing widely so that it's available. That if anyone certainly is ill or even thinks they might have been exposed to COVID-19, that they can get that test, and that the public health capacity is there, that should a case or a cluster of cases be identified, that they're able to rapidly go in and do the contact tracing and making sure that those people are managed well. So that's the way that I think public health is, and I think governments are positioned to, as they start to relax measures, there's potentially, and I think it's almost inevitable, there will be some cases, clusters, but you have the capacities in place, then you're able to actually manage it well and see if there are lessons learned from why those clusters and cases did occur, to maybe see if there might be implement moving forward.
Thank you very much.
Thank you, Dr. Noon. Next, Mackenzie.
Hi, Dr. New. Mackenzie Gray from CTV News. There have been reports recently that about 1,500 people who've come into the country have either told border guards or public health officials have deemed that these people would not be, or potentially not being, following the 14-day quarantine rules. So what things are public health putting in place to make sure that everyone who comes into Canada, there's been about 3 million people who've come since COVID has started, are actually quarantining? And secondly, what is your message to people who are considering, maybe I don't need a quarantine, numbers are down in Canada? What would you say to them?
Okay, so first of all, in terms of the measures put in place, we've also increased our presence, at the border in terms of land crossing. So there's an increased presence, I understand, in terms of CBSA agents and so on. So that's one thing. In terms of anyone coming into Canada, there is that obligatory 14-day quarantine under the Federal Quarantine Act. And not to get into too many details, everyone who enters the country has to show that they have a quarantine plan, that they can show that they have a place that they're going to go to, and that they're also able to fulfill the 14-day quarantine. In the rare sort of cases where individuals don't have a place to go or they don't have that definite plan, the federal officials, we also have designated quarantine facilities in which we can also put these individuals to monitor them for the full 14-day quarantine. In terms of the monitoring, there's between the federal government and also a provincial, local, there's certainly a system in terms of calling people up, reminding them of their quarantine obligations, making sure that they are aware of making sure they continue for the full 14 days. Most people, from what I've seen in terms of the data that's come in, have been very good in terms of what we call compliance. They accept the calls. They recognize that we're doing it not to badge or hound them, but really as a gentle reminder to continue doing what's, I think, in their best interest in terms of their health, but also to protect others. And so I guess my general overall message is that, Canadians or anyone else coming into the country, we've done well in Canada. But as we see, there is a global pandemic, and as the WHO said, unfortunately, the number of cases keeps increasing worldwide, and there are hotspots around the world. So if you are coming from outside of Canada, please, I think, understand that all of the efforts that Canadians have done inside of Canada to flatten the curve and to make sure that the transmission of the virus is as low as possible, please do your part to also not, as they say, introduce the virus into Canada as well.
For my follow-up, I know you're a big sports guy, so I've got two quick sports questions for you. Yesterday, it came to light that as a part of the bubble that the NHL is doing, they're planning on bringing about 50 technicians, camera people, sound people from the U.S. to come here. Many Canadians are wondering why we need that. There are a number of camera people who have been out of work here in this country. Did we, as a part of the plan that the NHL submitted to public health, was that a part of that? Why did we approve that? And secondly, once the playoffs get going, I know you're a hockey fan, would you feel comfortable going to a bar to watch a sports game or sit down and have a beer at this point in time inside?
Okay, first part. In terms of the other technicians, the discussions, and they're still actually ongoing with the NHL as we speak, is that we certainly looked at the protocols, and they're very tight with respect to the players in terms of coming in, doing your work quarantine, and then I say continuing to keep safe, and there's a regular testing regime. In sort of a more recent days, there's also been discussion that to be honest, it's a business. And so besides the players actually, quote, playing on the ice, there's obviously other specialists involved in, quotes, the production of the games in terms of televising the games, as you put it. And so that's also an active part of the discussion. In terms of those individuals also being important in terms of, say, putting the tournament on or the games on. With respect to those individuals, we're also actively are very seriously looking at the protocols so that they would be treated in the same way as the players. Very sort of tight work, sort of quarantine, also making sure there's regular testing, and also making sure that the measures put in place do not pose any risk to the general public. And then to your second question about watching the games, I'm looking forward to hockey. I won't say what my favorite hockey team is, because that could give me a lot of trouble and create lots of arguments, in my household and others. But I would say that at the present time, for myself, this is just my own risk tolerance, is that I would probably watch the games at home with my own very tight social bubble. Certainly have maybe a beer and some snacks, but I would not be specifically going to a bar. I think part of the experience of watching hockey games is to enjoy it in the company of others, to either, they're all fans with you of the same team, or even if they're not, that makes it maybe something more exciting to have arguments as the games are unfolding in front of you. But I think at the present time, at least for myself, I would do it in sort of the security and social bubble at home.
Thank you, Dr. New. Next question.
Hi, Dr. New. Ashley Burke, CBC News. Because we have this hotspot next door in the United States, do you think we should be stepping up how we're enforcing the Quarantine Act right now here in Canada? Do we need to do more, and what would that look like?
That's a good question. So certainly from the data and evidence we've done today, I think it's working well. I'm certainly not aware personally that there's been a sort of a big upswing or increase in cases which are related to travel, sort of people who've crossed the border and then subsequently developed COVID-19 Canada because of a sort of an infection that they've brought across the border. What we're seeing for the most part are actual outbreaks and cases for the virus which is continuing to circulate within Canada. For example, I think I'll highlight at this point one of the things which is concerning, I think, to public health authorities across the country is what's happening, I would say, with the young people. I think that that's something that we may need to maybe make an extra effort on in terms of what we might call segmented marketing or getting a message out. I think young people in general think that they're invincible. And we've had several situations where they've had household parties with lack of social distancing, etc., and that's led to, I think, outbreaks and public health authorities having to chase after contacts and so on. For example, if young people do choose to go, get together in a party without the proper measures, then what happens afterwards is that we know these young people also, are part of the community. If they then go to work, be in a fast food or restaurant, visiting parents and so on, that's how the virus can spread. So I think at the present time, with respect to the board and the Quarantine Act, in terms of how it's being managed and the risk being managed for travelers coming in, I think it's been managed well to date because there's no evidence of travel-associated cases. It's really a matter of dealing with what we already have here in Canada. And the other part, I guess I would mention now with respect to bars and so on, the other part I forgot to mention is that I would see another risk factor in terms of watching or getting together in a bar is that what do they serve in bars? It's alcohol, right? And as we all know, after one or two drinks, people might feel less inhibited. And certainly if you go in with good intentions in terms of, wearing your mask and social distancing and so on, who knows after one or two drinks if that might change. So that I would say is another risk factor. And that's just a personal opinion.
The National Contact Tracing app, it was supposed to start rolling out in Ontario on July 2nd. It's been delayed. Can you tell me what's going on behind the scenes specifically that has delayed this and what your concerns are?
My understanding is that there's still some fine sort of tuning and tweaking in terms of the app. Ontario being, I think, sort of the first pilot site, if you can call it, for this sort of national exposure app. I'm not aware of any major issues. I think it's just, as you say, sometimes there are, the devil's in the details, and I think there are things that are still being worked out. From say, a public health perspective, all of us are obviously very keen to make sure that any application, be it this one or anything else that might come down the road, certainly is a support to the what we call the public health objectives. As I think I've mentioned before, I think in terms of contact tracing, exposure, and so on, it really is, I think, at the end of the day, a very labor-intensive sort of human resource, I think, intensive effort. Technology can be a useful tool, but I don't think it automatically replaces what happens in terms of actually people chasing down, talking to people, and so on. One of the issues that it's been a long-standing issue in terms of the development of these apps is the issue of confidentiality and privacy. And so I think that remains foremost in terms of how these apps are actually sort of rolled out and making sure that with the technology that people's private information is safeguarded.
Thank you, Dr. Newt. Operator, we'll turn to the phone for one last question.
Ms. Sweeney from City News, please go ahead.
I'm wondering, Dr. Newt, do you have any criteria for reopening the border from a health perspective? What do you need to see out of the situation in the United States that would make you feel comfortable that we're not putting Canadians' health at risk? Like, does the U.S. have to hit a certain target for number of cases in a day, like less than 1,000 or 500 or whatever?
That's a difficult question. I'm not going to speak specifically about the United States, but certainly from a public health perspective, it's interesting having had discussions also with international colleagues. I'll just do the example in the European Union. One of I think a general criteria is that as we know, borders between countries are political borders, and sometimes there might be a natural border like a river and so on, but usually, obviously, they're political, and so the movement of people between countries and crossing a border, especially if you're looking at it from a COVID-19 and public health perspective, depends on, are the situations similar? So if, let's say if you have country A and country B, if the epidemiology is similar between the two countries, if you could say that the control measures, the capacity of public health and the healthcare system is similar in those two countries in terms of ability to detect cases, making sure there's good contact tracing in place, that they're able to stop chains of transmission, that there's access to healthcare services in a similar way between those two countries, A and B, then you might say, well, then there really is no reason to unduly restrict the movement of people between country A and country B. So I'll just leave it at that. And that's sort of, I think, in a general sense, the kind of thinking and the principles that they've been using in the European context. And I think we would be thinking in the same way here in Canada. Thank you.
Your follow-up, Cormac?
Yeah, and I know you're hesitant to talk about timelines in terms of reopening the border, but given your concerns about the current number of cases that we're seeing in the U.S. right now and the differences between Canada and the U.S., should Canadians be prepared for a much longer term than just 1 month or 2 months in terms of a border closure, or at least hesitations or concerns about traveling south of the border?
I can only give you my personal perspective. Certainly, from what I'm seeing or we're seeing happening in the U.S., I think the situation does differ from state to state, but in many states, I think there is the acknowledgement that there's ongoing community transmission that I think in some ways they don't have a good handle and control. For example, in California, they've actually, I think, sort of put certain sort of lockdown measures back in place in terms of closing bars and so on. So I think that individually at a state level, they are taking the right steps to address what's happening in terms of the changing epidemiology. I would say that knowing what we know about COVID-19 transmission and the epidemiology and the natural history, that it will take some time to see hopefully the positive benefits if, let's say, in the United States, they're able to better control the epidemiology of COVID-19. And so I would say that, yes, it certainly is more a matter of, I would say, several weeks and months, a month or so, to see hopefully if there is an impact in terms of what's happening there as opposed to days. So personally for myself, I'm certainly not planning to travel anywhere anytime soon. If I were to travel anywhere, I think I would stick to Canada for the time being. I think taking that into account, I think many Canadians are looking at staycations, staying close to their region or their province in terms of personally not anticipating going elsewhere outside of Canada at the present time.
Thank you, Dr. New. We do have one more question on the line, operator.
Yes, thank you. And the next question is from Rob Gillies from AP. Please go ahead.
Hi, Doctor. Thanks for doing this. I just wanted to ask you about baseball again. Is there a scenario where if the Blue Jays quarantine, self-isolated at the hotel like they're doing now, and visiting players also self-isolated and quarantined when they came to Canada for games, is that a scenario where you could approve, or is there just too many other hurdles? And what are the other hurdles that they need to get over to be able to play in Canada?
Thank you for the question. I think there's lots and lots of factors involved. I can't speak in terms of sort of the ongoing discussions where we're having with the Blue Jays in terms of what might be feasible. The point you're raising about visiting teams, I can appreciate that if, who knows what the potential for exposure risk is for the visiting teams. I don't know, for example, I'll pick the New York Yankees or the Florida Marlins, the players, what their living arrangements might be in their community, or what the risk is, and what the protocols might be in place for themselves and their families, etc. And then if they do come to Canada, if there's a very tight quarantine bubble and they don't leave the hotel and just go to the games, that's one aspect. But I can appreciate for the Blue Jays, for the players, that's tough because they've had this very tight quarantine and work bubble for spring training here in Canada. But if they were to leave Canada and go on a road trip, you can anticipate it. It's hard to sort of look at all of the possible factors involved in terms of what the risk might be for themselves. Leaving Canada and then coming back. So there are lots of factors in play, and I can't pretend to know all of the sort of possibilities and things that need to be looked at, but that certainly, I think that is a major issue in terms of the travel back and forth across the U.S. border.
Is it fair to say it's just too fraught to approve this, considering they're not in one bubble? I mean, as you say, it's back and forth travel, many different cities, surging cases in the U.S. That it's just too big of an ask.
I would say that we're always open. I think we're continuing to have discussions with the Blue Jays and Major League Baseball, seeing what's in the realm of the possible. I don't know if I'm going to put myself out there, in terms of what is in the art of the possible. For example, if you look at the epidemiology of COVID-19 in Canada, I could get myself in trouble. I'm going to say it anyway. Look at the epidemiology of COVID-19 here in Canada. I know the schedule's already been set for the Blue Jays, but it may well be trying to respect the quarantine and keeping players safe. I don't know. Maybe one option might be to look at maybe the Blue Jays staying in Canada for an extended period of time and playing quite a long series of games, be it the home team or the away team here in Canada. I don't know. There's all sorts of things that could be possibly considered. It's not for me to sort of consider, put on the table. I'm just thinking from a pure public health point of view, epidemiology, risk of exposure, what might be things that could be looked at.
Thank you, Dr. New. That concludes today's press conference.
Thank you.
Thank you. Merci.